Well podcast. My name is Anna Maria and I'm your host. It is such a rainy day here in London, so you may be able to hear some of that rain in the background. I have one of those flat top roofs where I do my recordings, so there's a lovely kind of sound in the background going on. That's what you're hearing. Today's topic is really interesting and obviously one that I hold very close to my heart. And as I dove more into the info and started to think about all the reasons why women might experience more pain than men, it just became really clear and really empowering to start to think about the ways in which our understanding about those reasons can help us to sort of manage and overcome sort of struggles with pain management. So we're going to dive in straight away. I would just like to preface today's show by saying that this is not medical advice and everything I share is based on experience with working with clients as well as my own research and studies. And if you suspect that you have any of these conditions, please seek help from your GP or medical professional in order to advise you in the best possible way. My intention is for this information to be a source of empowerment and reassurance that there are ways to manage and work with chronic and persistent pain conditions. It has really helped me in managing and working with my own, so I hope that it will help you as well. I hope you enjoy the show. There are a number of back issues which women are more susceptible to even. And there are also some factors which mean women may be more susceptible to back pain becoming a chronic condition. So as you may have heard in previous episodes, we have acute pain, which is kind of sudden onset and usually clears up within 6 weeks. Anything that kind of goes beyond that is categorized as a chronic condition, so a chronic pain condition. And we know that chronic pain conditions are multi-layered, so there's a lot of factors at play that mean that pain becomes persistent and ongoing. So some conditions are exclusive to women or persons with a uterus, and a great many problems typically begin to appear postmenopausal. So this is sort of into our 50s or a little bit earlier than that as well. So we're going to talk about some of the most common causes of back pain in women today and the reasons they might occur and some of the tools we can use to manage and prevent pain turning into chronic pain. So if you've been listening to the series I've been doing on back pain, you'll be familiar with the idea that multiple factors affect our experience of pain. This includes our biology and genetics, social conditions, exercise, our ability to process information in the brain. And for women, there are a number of other things to consider, which include our hormones, going through puberty, reproductive status, and menstrual cycle. All of these things affect our threshold and perception of pain. On a personal note, I can definitely share that around the time of my period, I start to experience a more sensitivity to pain, a sense that those little niggles and aches and pains that are kind of present there on a day-to-day basis just become a little bit more pronounced. So everything feels a little bit more sensitive. And this can be linked to the drop in estrogen and progesterone in the body just about before you're about to have a flow. And this can affect mood. It can affect our sensitivity to pain. It can cause headaches and a whole series of other uncomfortable and unpleasant stuff. So I'd like to go into a little bit on the conditions which only affect women or people with a uterus and why this is. So the first one we're going to discuss in brief is piriformis syndrome. So piriformis syndrome is a condition which is caused by irritation or compression of the sciatic nerve. This nerve can be found near the piriformis muscle, which is in your bum. The nerve and the muscle travel through the same opening and they're side by side in the pelvis. And this proximity to one another means that if there's any issues that might arise, it can cause a kind of pinching or compression on that nerve. And it's rare but not unheard of that the nerve might actually travel through the piriformis muscle, which means it's more susceptible to having issues. So this condition is more common in women. As far as I could tell, the answer is not really clear as to why, because men and women both have this muscle, and we can have a similar kind of thing going on in terms of the nerve and the muscle running quite close together. So there was a little bit of inconclusive information there as to why. So typically we hear people complain of a condition called sciatica. And sciatica is actually more of an umbrella term to describe any condition which causes sort of pain in the bum up to the lower back and radiating down the back of the leg. So there are a few conditions that kind of have a similar kind of pain pattern. But this particular one is described as having sharp, severe radiating pain from the lower back or bum down the back of the leg and into the thigh, calf, and possibly the foot. So the symptoms for this condition are sort of pain or numbness radiating from your sacrum. So your sacrum is that little triangular shaped bone in between the two ilium, those elephant ear shaped bones at the back of your pelvis. And down the back of the leg. And then pain can improve with movement. So if you find that you have this kind of pain in your bum down the back of the leg, and once you get a little bit of movement going, that sort of helps the issue. And it gets worse with prolonged sitting. So after being sitting at your desk for a long time and you get up, and that kind of shooting pain down the leg might be a little bit more severe. And when the hip is moved or rotated outwards, so that kind of external rotation, it's what it's called, against resistance, and that might feel a little bit like it creates that same sort of pain response that feels a bit like sciatic pain. So if you suspect you might have piriformis syndrome, highly recommend you visit a musculoskeletal expert to get it properly assessed so that you can begin rehabilitation. And it's one of those that can be really easily rehabilitated once you know exactly what the cause is, what's going on, and have somebody give you the correct exercises to work with. And the next one we'll speak about is sacroiliac joint dysfunction. So 50 to 80% of women experience this particular type of back pain during pregnancy. So it's essentially, as it says on the tin, a dysfunction of your SI joint, so your sacroiliac joint. So again, the sacrum, if we think about it, it's that little triangular shaped bone in between the two ilium. And, it looks like it's quite secure if you were to look at like a skeleton, but it actually has a little bit of movement and sort of serrated edges that link into the edge of the ilium. So there's a tiny bit of movement and play. And as we know, or as I'll share with you now, during pregnancy, there is an increase in relaxin, which is a reproductive hormone, which is produced by your ovaries and the placenta even during pregnancy. So it helps to loosen and relax your muscles, joints, and ligaments during pregnancy to help your body stretch, which is really positive as it helps you to give birth. But it can also create a little bit of instability in those joint areas. And particularly if you are someone who has a bit of hypermobility in your body already, this can become a bit more of an issue, as the strong ligaments that allow just a little bit of movement around the sacrum maybe become a little bit more relaxed and give rise to more movement in that area. So women on a whole are 8 times more likely to experience sacroiliac joint dysfunction, whether they become pregnant or not. Why, I hear you asking? Well, there is a few reasons, some anatomical factors and some chemistry factors. So women have one less sacral joint segment than men to lock into the pelvis, and stabilize it. And this gives a little bit more room to enable persons with the uterus to give birth, right? Women have wider hips than men, which increases torque across the SI joint when walking or running. And this too can be related to the ability to have children. And the sacroiliac joint surfaces are shallower on women than on men, which also diminishes that ability to be a really stable joint. And hormonal changes during menstruation, pregnancy, and lactation can all make ligaments more flexible. And this is so, you guessed it, people with a uterus can bear children. So this can all leave the SI joint very mobile. And when joints are overly mobile, this causes the surrounding muscles to tighten up in order to compensate, which can cause pain and inflammation. So the same kind of factors which make women supposedly more flexible than men in certain shapes and poses we might do in our yoga practice also have the kind of double-edged sword effect of meaning that there might be a little bit more instability. And this is not totally a huge problem. If we work to strengthen all those ligaments and joints and muscles that support the sacrum through a very thoughtful kind of yoga practice, we can really help to support this area of the sacrum and to have a really safe and supportive practice. So if you suspect that you might have sacroiliac joint dysfunction, you've probably been diagnosed with it already. You may have experienced a sharp stabbing pain that radiates from your hips and pelvis up to the lower back and down to the thighs. It might feel even a bit numb or tingly on one leg, or it feels like maybe your legs are about to buckle. And as you can see, sort of similar symptoms as you might experience with the piriformis syndrome, which makes it really hard to diagnose without like the proper testing and looking orthopedic testing, range of movement testing. As with piriformis syndrome, once you have a correct assessment of the condition, you can begin to work to strengthen and stabilize into your sacroiliac joint to have a really sort of supportive practice for you. The next condition we're going to explore a little bit today is spinal osteoarthritis. So women are more likely than men to develop osteoarthritis, particularly in the lumbar spine. So this difference is particularly noticeable after the age of 50, and evidence kind of points to the fact that as women's estrogen levels drop during menopause, this has a sort of negative effect on the health of our facet joints. Osteoarthritis affects each person differently, and for some people, osteoarthritis is relatively mild and doesn't affect your day-to-day activities, and for others, it can cause significant pain. As the damage of the soft tissue in the joint gets worse, pain, swelling, and loss of joint motion starts to set in. And when we're in pain, we may be less active, and this can lead to muscle weakness, which may cause more stress on the joint. So it's one of these where we really need to sort of understand what's going on in the body and take those steps to start to support the muscles, joints, and ligaments that support the structure of your spine, of your spinal structure and column. So the symptoms, this is one that definitely needs to be diagnosed by your GP, and really important to get that diagnosed as early as possible, and then they can start you on a course of treatment which might include high doses of calcium and vitamin D in order to support your bones as much as possible. So this is one of those which is a degenerative disease, which over time means it gets a little bit worse and worse. But definitely getting to it as soon as possible helps us to mitigate or prevent major issues like falls and breakages. So if we start to really implement a strengthening program, which includes weight-bearing exercises, we can help to really support the structures that support the spine, work on practices like gentle balances, especially as we get older, we tend to lose that kind of ability, or maybe it wasn't even there in the first place. It's definitely something that we can all do a little bit of work on. Just to help our ability to prevent those falls, which could lead to breakages in bones, which could put you at a disadvantage in terms of being able to take care of yourself, which could lead to a sense of loss of autonomy and confidence. The next condition we'll speak about is degenerative spondylolisthesis, which I had to write out for myself phonetically in order to be able to pronounce it hopefully correctly. This condition is a condition where one of the spinal vertebra has slipped forward over another one below it. So as the name suggests, this is usually one that happens over the course of our lifetime as we begin to age and the bones begin to age and joints and ligaments. They become less able to sort of maintain the alignment of our spine as some of that weakness comes in. And it's most common in the spinal vertebra of L4, L5. So those are the kind of lowest ones closest to just above the sacrum. But it can occur elsewhere as well. It's just more common in those two vertebrae. So your GP, again, will need to test your movement and balance and take a case history, even perhaps a CT scan or an X-ray or MRI to determine this diagnosis. So the symptoms which you might experience if you have this condition are low back pain, again, sciatic type symptoms, sort of aching pain in the hip, the bum and lower back that radiates and spreads into the back of the thigh and leg. So again, remember thinking back on the previous sacroiliac joint dysfunction and piriformis, these are all quite similar symptoms. So it's hard to exactly pinpoint. That's why a diagnosis is really essential. So it can also be really treated through physical therapy, strengthening exercises, gentle movements, and sometimes a bit of rest and restriction of certain physical activities is also required. Another condition which has a higher instance in women is tailbone pain. So our coccyx, right? Pain in our coccyx. Women are 5 times more likely to develop this condition, which is called coccydynia, than men. And the tailbone is that small but important bone at the very lowest part of your spine. Those little fuse bones. It works with the ischial tuberosities, those sitting bones, which you may have heard in a yoga class, to stabilize the structure while we're seated. So it kind of acts like a little bit of a tripod. This ischial tuberosities or sitting bones on either side, and then the tailbone slightly back behind. So it gives us that kind of center of gravity to support the torso as we're sitting. So how can this become a condition or an issue? Through a backward fall. So this may cause damage to our tailbone. I'm sure you've heard of people breaking their tailbone when they, fall backwards from a ski accident. It does happen. Or the location of the coccyx makes it particularly susceptible to injury, particularly during birth. And this is why maybe women experience it a bit more. So especially if there's been a difficult labor or there has been instrument used during delivery to help the delivery of the baby. So treating tailbone pain is best approached from a multi-layered system of treatment, with movement therapy being included, ergonomic adaptations, right? And possibly even psychotherapy has been shown to be really helpful in the management of this issue. And what you might experience if you have this condition is very localized pain just over the area of your tailbone. You'll kind of know if you've had a fall or if you've had a tough labor to maybe get that checked out if that seems to be an issue. Another one I'd like to just bring up briefly today, which back pain is more of a kind of secondary symptom of this rather than being a primary one, is endometriosis, particularly because this just affects people with a uterus. So it's a very painful condition caused by the growth of tissue which normally lines your uterus, called the endometrium. And this starts to grow outside of your uterus. It acts in the same way as the endometrium would within the womb. So around the time of your flow, it will start to bleed as well. But because it has nowhere to go, this can become a bit of an issue and it can become extremely, extremely painful. So if it has spread to other organs, it can cause pain even with bowel motions, pain with a full bladder or during urination, or lower back and leg pain. So things to look out for are abnormally painful periods, pain during intercourse, excessive bleeding during menstruation, fatigue, diarrhea, constipation, bloating, or nausea, especially during your menstrual periods. Definitely go speak to your GP about this, as they will be the best ones to be able to assist you and tell you what the next steps are for this. But a lot of gentle movement could be also really helpful to just help to manage any of the pain that arises from this condition as well as meditation and a few other the things that I'm going to suggest later as tips for managing pain and back pain in general. The next one we're going to speak about today is spinal osteoporosis. So osteoporosis, different to osteoarthritis. Osteoporosis is essentially the loss of bone density. Spinal compression fractures can occur as a result of osteoporosis and are actually quite common. Osteoporosis is especially common in postmenopausal women. So again, this is due to the drop in estrogen, and approximately 4 times as many women have low bone mass than men. And the symptoms might be experiencing some kind of back pain, but some people may not even notice any pain at all. So things to look out for are sudden severe back pain or pain that gets worse when standing or walking, or trouble bending or twisting your body. This is one, again, that needs to really be checked out by your GP. They'll send you for an MRI to assess whether there's a fracture or any risk of fracture. And the best way to prevent a fracture is to prevent osteoporosis. So if you've already been diagnosed, you can take steps to keep from getting worse. Eating a diet rich in calcium and vitamin D and all the micro and macronutrients required for spinal and bone health, and getting regular exercise, especially weight bearing and muscle strengthening, and generally keeping a healthy weight for your body is going to be really beneficial for preventing extra sort of strain on your bones. I hope I've really highlighted that all of these conditions can be managed and treated. However, if the pain we experience becomes a persistent, untreated issue, it can cause a woman's entire life to be affected, which contributes to depressive symptoms, restlessness and fatigue, and a general loss in quality of life. So evidence from recent studies reveals that females are more susceptible to clinical pain conditions, especially after an operation or any kind of procedural pain. So the rise in prevalence of chronic pain in women mainly originates from the combination of developmental and family issues. So studies are not exactly conclusive, but some research has suggested that as we get older, we become more sensitive to pain as well. And studies have even suggested that society expects women to report more pain. Heredity might also have an impact on our pain tolerance levels. This is something to really be careful of. I have a lot of clients who will say, oh, well, my mother had back pain or arthritis and therefore I will probably get it. So there's a kind of expectation bias around pain conditions. Just because a parent or family member experienced some kind of pain condition does not inherently mean that you will have it as well. And there's a lot of measures that we can take to prevent or mitigate our risk. Racial and cultural disparities are as well recognized as creating cultural perspectives that strongly determine the perceptual experience of pain. This means pain is a social and political problem as well. So what is the solution, and how can we begin to manage pain in women? A multidimensional approach is required in the treatment of pain. Healthcare professionals and complementary therapists understand this multi-layered approach more and more, and they're using it. Psychological approaches for chronic pain management developed as a consequence of our more complex understanding of pain. These understandings help us to recognize the contribution of psychosocial and physiological processes that occur in the perception of pain, and that in turn allows us to understand the importance of this puzzle piece in the treatment of pain. Mindfulness-based interventions have emerged as a means to treat several chronic conditions. such as chronic pain, depression, anxiety, stress, and insomnia, with really, really great results. CBT, or cognitive behavioral therapy, have been documented as being really successful at managing chronic low back pain. It primarily focuses on psychoeducation about pain and behavioral components related to the syndrome. This is basically like a teacher-student model. The learners are given relevant knowledge and skills to manage their pain, and the main goal of the therapist is to increase understanding of pain and put in management efforts to enhance life. So, tips for coping with chronic pain if you're experiencing it. Physical movement is so important. It helps us to affect fear avoidance mechanisms, which relate to pain and affect people in staying active. That's why I really think yoga is such a valuable tool, as we're able to explore the body with curiosity and compassion, finding ways to move that really help to support your body, help you to move into places gently and gradually so that you can bring that movement back, that confidence back. Because when people have that fear avoidance, it leads to negative results, further decreasing their mobility and potentially increasing pain. So we should really strive to remain active, engage in everyday movement activities which bring us joy. That's why I'm also a huge proponent of doing the movement that you're doing, right? So anything that feels good for you, whether that's a walk. But walks have been shown to be highly successful for helping to manage back pain as well. So find what you love and how you love to move. Number 2, set desired goals. So pain management requires us to have realistic goals and develops from our own personal motivation. So we're learning to befriend the body again, meeting yourself where you are every day and recognizing that this changes on a regular basis. It allows us to see our limitations, but not to let them limit us. Number 3, distracting pain. So instead of allowing ourselves to be pulled into that spiral of thinking about our pain constantly, find ways to engage your mind through social engagements, movement-based practices, allowing yourself to create pleasant feelings which help you to manage your pain. Number 4, your social support system is so important. Social support is such an important factor for chronic pain. Being with people who care for us and listen to us helps us decrease instances of depression and anxiety through talking and sharing our experiences. So to finish, I'd just like to say that chronic pain in women is influenced by a combination of biological, psychological, and social factors. As of yet, most of the treatment interventions we have available to us do not completely eliminate pain entirely, but we can learn to be compassionate towards ourselves and to not become our pain, and to learn self-management skills that can have a huge impact on our mental health and overall quality of life. Thank you so much for listening to today's episode. I hope you found it interesting and helpful in some way. If you've got any comments or would like to chat, or maybe you have some information, personal stories on some of these conditions yourself, I would love to hear from you. If you are looking for a movement-based practice that will help you to develop these skills of befriending the body, finding more compassion towards your body, and starting a mindfulness-based practice, you can join the waitlist for my back care program, which is starting early next year, by heading on over to the website. Thank you once again for being here and for listening all the way to the end. I so appreciate you being here. Please drop me any comments. I'd love to hear from you, and I'll speak to you again very soon. Take care and be well.